drought is a unique disaster that covers large areas of the world and can persist for long periods of time. Identifying where resources and personnel need to be sent within the affected areas to help the local population is a core part of the disaster response and relief effort. To address this need, HSR.health has developed, through the support of the Open Geospatial Consortium's 2023 Disasters Pilot and pilot sponsors Natural Resources Canada, our Drought Health Risk Index, which has been tailored for Manitoba, Canada. The vulnerable populations and health impacts from drought are broad and far-reaching, and only exacerbated in severity the longer a drought lasts. Some of the impacts include increased prevalence of disease, heat stress, dehydration, malnutrition, and impacts on mental health. The Drought Health Risk Index identifies a priori the health and medical needs of the impacted population and informs emergency response personnel, public health officials, governments, economic development, city and civic planners, and global public health organizations the information that they need to develop policies for resilience during a drought to limit its impact, as well as speed response and supply efforts during a drought scenario. Shown here is a dashboard built in the ArcGIS Online environment of the Drought Health Risk Index for Manitoba, overlaid with drought severity from the North American Drought Monitor that indicates the regions of relatively higher health impacts from droughts and where resources may be more at need. The underlying health and social data of the population is included in the dashboard and associated layer, a subset of which is shown in the highlighted table. The Drought Health Risk Index can be combined with other indicators such as the Drought Severity Indicator from Pixelytics that offers additional information on the severity of drought in Manitoba. We utilize the NAPSIG symbology for the Drought Health Risk Index, which was recommended for layers pertaining to disaster response based off of input from FEMA. The Drought Health Risk Index is calculated through a weighted combination of the health and social characteristics of the impacted population. The populations at greater risk of adverse health outcomes during and after a drought include the elderly, those with difficulty with mobility, and those requiring regularly scheduled care such as dialysis. The data for these factors was sourced from Statistics Canada, the Canadian Chronic Disease Surveillance System, the North American Drought Monitor, and Pixelytics. The primary standards utilized for the Drought Health Risk Index include WMS, WFS, OGC Features API, ISO 3116-2, GeoJSON, and GeoParquet. During this pilot, we began researching standards relevant to the data utilized, including ISO 3116-2, ISO TC 215 Health Informatics, and HL7. Future pilot efforts should continue to explore standards relating to health and demographic data and data exchange. The Drought Health Risk Index is published on HSR.health's OpenGeoMD platform, which is deployed in the AWS cloud through both an Esri ArcGIS Enterprise stack and a GeoNode and GeoServer open source stack, as well as made available through other catalogs in the pilot. When viewing each layer for the Drought Health Risk Index in the OpenGeoMD platform, users can import the layer into their own system through a WMS GET request via a link in the top right. Additionally, the data is made available through an OGC API instance as shown here. The Drought Health Risk Index will remain available on the OpenGeoMD platform as a persistent demonstrator. To expand upon the capabilities of the Health Risk Index, it will be incorporated into our generative AI-based GeoAI for Public Health platform that utilizes decision support and generative AIs based on large language models to provide supplementary information and real-time guidance to emergency response personnel to aid in responding to the impacted populations. In future climate and disaster-related OGC pilots, the capabilities of the indicator can be expanded through incorporating climate models and synthetic population modeling to predict the health impacts and severity of future droughts in Manitoba. Additionally, we can demonstrate interoperability through ingesting the outputs from the fellow participants in this disasters pilot to enhance the capabilities of the Drought Health Risk Index. Thank you very much for watching this demo. For additional information, please visit our website or contact us at impact@hsr.health.